This concept of team really emerged um, when I was thinking about, especially the leadership team of UMASH when we first started. We had a physician, we had an injury specialist, and then we had a veterinarian as a leadership team. And we did function as a team because we really did complement one another. And this really translated into many of our activities. And so what I'd like to do is talk a little bit about us, as a center, who we are. And then I want to just provide some examples of some of the teamwork that our team has done. And so let's just go ahead and begin. And basically the examples I want to give is one, how we've been able to work with a number of partners to identify the risk, how we've been responding to the needs of our community, and then how we've been doing some prevention efforts. So as a reminder, the mission of the National Institutes for Occupational Safety and Health Ag Centers is to minimize the burden of occupational disease and injury to agricultural workers and their families. And we do that through research, through prevention, through communication. And more specifically, our center, the UMASH Center, is actually focused in the Upper Midwest, and we focus on our partners, our states around us, and kind of the agricultural needs in our particular areas. As you can imagine, we're quite different from strawberry Florida growers or citrus growers in California, and so our needs are actually somewhat different. Also, we firmly believe in what we call the One Health principle or the One Health approach. And this involves bringing together interdisciplinary efforts to actually look at some of the issues, to really look at health outcomes for people, for animals and plants, in the environment. We need to actually involve and think about how do we look at that broad protections through coordinating, communicating, and collaborating. And so it does involve a multidisciplinary effort to actually address many of the challenges that are facing us. And that's actually one of the first things as a center we've had to deal with. What are some of the health and safety challenges that affect the farmers in our area? And so as a reminder, agriculture is dangerous. It is an unfortunate thing that a job actually is associated with higher fatality, higher injuries, and especially with animal agriculture, it's even more so. And the costs are actually quite remarkable. And I apologize, you can't really probably see the details of the news clipping there, but basically it's an auction. It's a dairy auction, and this is a very much a reality of which. And they talk about the fact that two brothers didn't make it. That basically the silo fell on them and basically killed two of the three brothers. And so the fact that they have to sell their farm is an unfortunate event, and does unfortunately occur here in the Upper Midwest. However, we know that this represents, these reported injuries represent probably a very tip of the iceberg of some of the issues that are occurring on farms regarding injuries and illnesses. And so one is to really understand what these are, and then how can we actually intervene and actually prevent some of these as well. And so part of it is identifying the risks on a farm. And as you can imagine, these risks might vary quite a bit. If you look specifically, this is actually a nice little video out of Australia, kind of a, can you identify the potential risks on this farm? And, it could be, if you look at this, it could be as simple as noticing that he's got probably an unprotected auger he's handling. This individual is basically at a very high place. Here's somebody who's on an ATV without a helmet and also has a passenger. There are chemicals. There are kids that potentially be playing in areas that might be dangerous. Unsafe practices, using a chainsaw, probably not appropriately handling hay bales. So the hazards actually are quite remarkable, or can be quite remarkable, especially in our farming operations. And unfortunately, last year we saw a number of because of our wet season, of unfortunate death events, especially due to silos and grain bins. And so that's why it was really exciting to hear Commissioner Thompson talk about some of the interventions. How do we prevent this? How do we actually educate? How do we actually go out and provide outreach? How do we actually engage in trying to prevent some of these injuries, and seeing really the state recognizing the importance of its farming community and supporting that. So my hat's off to our state legislature and many folks that have really worked hard to help in that effort. Also, in looking just at news clippings, this is news clippings for the last 3 years, and you can see that there are a number of common themes that run through, injuries, especially for our Minnesota farm families. So ATVs and tractor rollovers and equipment-related, auger-related issues clearly are up there, and so we need an ongoing awareness of some of those issues. And you can see, especially for last year, grain bin and silo issues were most notable in 2019. Also, through some work, through the Minnesota Department of Health in partnership with UMASH, they were able to look at something we probably don't think much about, and those would be illnesses that we potentially could get in working on farms. And so this could be things like salmonella and cryptosporidiosis and campylobacter. And one of the things in their particular study that just got published was the higher rates, especially for those that are working in rural and farming areas, than those that are not. And so they estimated the incidence of these zoonotic diseases, these diseases that we can get from animals who live and work on farms, was 147 per 10,000 people versus 18.5 per 10,000. So almost an eightfold, increase in risk for those individuals working with these animals. And so that's not to be unexpected, but it does show you something that we sometimes don't talk about, that there are those sometimes inherent risks that are associated with farming. And with that, we've tried to actually identify what these risks are, and we've developed some resources really to try to develop to prevent that. And an example of that is the issue of influenza. Influenza can be shared to pigs as well as from pigs. And so, how do we actually have workers think about that? And how do we make sure that we're not sharing something to the pigs as well as getting something from the pigs? The other thing that I can be really proud of our team is that we've really developed a number of reminders for folks to think about what are some of the potential hazards that occur at a farm. And so in particular, this is actually one. Usually it's a list of 10 items to think about, specifically on grain handling, and actually talking about just some things to remind yourself, especially as you go into different seasons. And so we've got a website that actually focuses in on a number of different farm-related hazards that folks can just think about, say, hey, these are some things for us to think about, maybe as we get into the harvest season and some other things as well. So again, what this means is that it takes a team to identify these risks. It's the healthcare providers first to recognize kind of that occupational exposure. It's those researchers that might actually try to dive into and figure out that, yes, there are more bacterial diseases that actually farm families and farm workers can get. It might be the way that industrial hygienists think about how we design things, or agricultural engineers in that regard. And then also, why do we do what we do? The importance of having, anthropologists and sociologists and other behavioral specialists help us to understand it. So they're part of those teams as well. And because I'm a veterinarian, I had to put veterinarian because, we see things we're working on, oftentimes many of our livestock operations as well. So just a reminder that, again, it takes a team. What I'd like to do next is actually dive into a couple of specific examples that our team has been working on. And one is actually responding to these needs, and the title is Be Nice to Cows. And so we begin this as an initial look where we're identifying some of the injury risks for dairy workers. And one of the things I just wanted to highlight here is just the mere fact that a third of the injuries that are occurring on dairies was actually due to cattle, actually direct interactions with cattle, which is not unexpected. They're big animals, and you're working with them on a regular basis, and so there's a real chance that an individual can get injured, especially if they don't understand the animal or actually have appropriate structures to actually move those animals. And so building on that, the team also did a survey of dairy producers and their cattle handling practices. And there's a couple notable things that they found. One is that most producers learn their cattle handling skills from their family members. Now, that could be a good thing or a bad thing. You could have a good trainer in the family or a not so good trainer. Also, producers thought that the skill of the human handler was probably the most important factor for establishing good cattle flow. And so just the importance of really understanding cattle is really important, especially if you're going to work around them. And there might be some misnomers or some misinformation that might be guiding your thinking as you're in. So it's important to have the correct information. And also they found that time limitations and language barriers were considered really serious challenges for worker training. And so this helped us to think about, well, how do we actually have people think about, how do we work around animals? And so there are some principles that have been around for a long period of time, but one is to re-emphasize that as part of the training process and providing a mechanism that's easy to train workers. And so one is what we call low stress cattle handling or stockmanship. So this is where, we get cows to do what we want them to do with as little stress on the cows as well as the people. And we do that because it's an animal welfare issue. We want less stress on those animals so that they're actually more productive. And then also we want employees to feel comfortable while we're working around those cows. And so part of that is to develop some materials, recognizing that there are people that actually are specialists in understanding animal behavior, design issues for how we handle animals. And then also for those trainers, those teachers, those educators to think about how do we actually teach this to the varying audiences that we have. So part of that is we created a couple of simple things. One is what we call people points, reminder that the cow is always right, especially when it's 1,400 pounds, 1,600 pounds. And also, if you want to be efficient, thinking about some simple acronyms. Now this works for if you're English speaker, if you're a Spanish speaker, there are different acronyms that we use, but what we term PALS, basically, can you be patient around the animal? Do you consider the angle of your approach? Do you think about what your location is in regard to those animals? And remember that cows actually travel slower than humans do. And so, basically needing to slow yourself down as you're moving those animals. So again, understanding these principles and putting them in a way that people can understand. So with that, we created a 5-video demonstration video that focuses on understanding the predictable behavior of animals to improve milk production, how a cow uses her senses, working in the pressure zone, moving cows more efficiently, and then making the milking parlor a happy place. So these are 5 short videos that can be used for training, and then also a number of different materials that are readily available. And in addition, engaging instructional designers and others, we've actually then assembled some teaching guides, which actually for a producer or for somebody on a dairy can actually then say, this is some tools that we can use to actually think about how do we onboard new employees, how do we remind employees to work around the animals as well. So again, this is a team, an animal handling team. An animal handling team that actually involves animal behaviorists, again, researchers to understand how animals behave, agricultural engineers, veterinarian educators that actually all came together to try to create, these materials. The next specific example I wanted to do is, again, responding to needs and focusing on some work on agritourism. This has been an important piece of enhancing revenue, especially for farmers during tough times, and to bring people onto the farm. But there are some inherent risks. And so, this was actually a news release from many years ago about an outbreak of E. coli 0157 at a pumpkin patch that had a petting zoo. And this is the initial press release of 3 Minnesota residents who became ill, after contact with animals at that pumpkin patch. And so to many producers, they didn't really think about this or were aware that these risks are. So it's important for us to think about how do we prevent these type of outbreaks? How can we help the producers? What expertise is needed? What are some of those risks, and what are reasonable precautions that people should take? And so again, a team needs to come together to really come to help support that. And with that, we've been working with a number of key partners in national organizations and other folks to talk about some basic things like hand washing and layout plans for helping folks that do want to have an agritourism event. And try to do it in a way that actually is something for kids, something interactive for teachers, and so really supporting that kind of that broad team approach to create really materials that will engage a variety of different audiences. The next one I just wanted to focus in on is some prevention work that we've been doing, focusing on training immigrant workers on dairies. And this is a very important area. When we think about immigrant labor issues, really, immigrant labor accounts for 51% of all dairy labor. So it's an important part of our dairy industry, even here in Wisconsin, Minnesota, South Dakota, Iowa, and North Dakota. And dairies actually that employ immigrant labor produce most of the milk in the U.S. So they are really important, workforce for our dairy industry. So with that, there are some things that we wanted to do to support that particular group. And so one is recognizing that a majority of these workers are Hispanic. So providing, a curriculum that is language appropriate. Also that kind of meets the needs of farms to be OSHA compliant, and also to try to do it in a timely manner. And so we have an exceptional team that goes out early in the morning, late at night, usually when the milkers are coming onto a shift or off a shift. And they provide really, lesson-specific trainings for those workers to understand. Sometimes we use a comic book resource. It's a step-by-step guide. And then also we're trying to identify, specific leaders within that work group that actually can then, serve as, in a sense, community health workers to engage their broader group as well. This particular program, we've got a number of curriculum there, and that includes, what are the hazards? Some basics on animal handling, understanding the issues of machinery and equipment. What are worker rights in the U.S.? What are some issues regarding chemical safety in confined spaces, things that they need to be aware of? And then basically providing a forum for them to ask questions if they don't understand or had some questions about their particular type of work environment. So that's an example of, again, another prevention approach, another example of trying to create materials that are really specific for our audience, really to kind of reinforce those health and safety messages. So this really was a very quick overview of some of the things that we've been doing regarding assembling teams to address the challenges of our farming community. And so I want to leave you just with a couple thoughts. One is that there are a number of challenges that really do face our farmers, and it changes. Farming is not a static industry, it's dynamic, and we need to be responsive to these evolving conditions for farming. It might be the changing climatic conditions like we saw last year, especially with a very wet year. It also could be involved in economics and how those economics drive the way that farming is done. It also could be the introduction of diseases, as we've seen very much so with COVID-19. Normally they're worried about diseases that affect the animals, and that can wipe out animals. And we've seen that especially, with highly pathogenic avian influenza, in 2015 here in the state. We've seen it with the introduction of unique diseases, especially for the swine industry that affect them. But also we've got the disease like COVID-19, which is affecting basically the workforce and how we do the work.
And we have seen, unfortunately, the spread into our rural communities, even though we have this sense of isolationism or that we're spread out and it's less likely to be an issue. Actually, some of our highest incidences are occurring in our rural communities. And so with these evolving challenges, it will require new team members. And so we do really need to create a responsive team for these challenges. We need to think about educators and community leaders and extension, healthcare providers, veterinarians, nutritionists, industrial hygienists, many others that are that can be part of that team, especially with the different types, a myriad of different types of challenges that might be affecting our rural communities. And then, lastly, I just want to emphasize that this really does come back to our basic principle of having a One Health approach. Recognizing that we need to coordinate, communicate, collaborate, identify who those key partners are to really, again, achieve the best possible health outcomes, for the people, for the animals, for the plants, for our environment. And so with that, I will turn this back over to our moderator. Hopefully I've kept on time. I did not see any waving hands, so I think we're okay. So Amy, I'll kick it back to you.
Thank you, Jeff. That was great. I appreciate that One Health perspective. I think nowhere is it more apparent than in agriculture, where you see how interconnected and interdependent human health, animal health, and environmental health are, and that you need a collaborative approach to address that. And also just speaking to the need for diversity within a team makes you more effective and dynamic, especially as new issues emerge, and really helping to reach out to our community members and ag workers of different backgrounds. So I appreciate that perspective. I welcome everyone. You can use the Q&A feature to ask any questions for Jeff. In the meantime, I do have one. Can you give us some examples of emerging issues that you see in agriculture where this collaborative One Health approach is critical?
I think there's a couple, with not wanting to take too much time. The one thing, there were a couple of issues that really has come to our attention that we really did need a broad team. And one that we actually were reluctant to pick up because we didn't feel like we had the expertise was the area of mental health and mental health resiliency. And so actually several years ago, as a way to try to address that, we actually did a forum where we just said, we're just going to bring people together and try to figure out, in a room, who's doing what, and, who are some of the key people we need to engage in that process. And so, with that, our team has done an amazing job of actually engaging a number of partners, understanding what other folks are doing, trying to come alongside and support those. So that's an example of where working with mental health specialists, those that are in the community, those that are actually more engaged directly in hearing about the issues, for example, our Minnesota Department of Agriculture more directly through their suicide prevention lines, extension and their work, and basically the people that are actually engaging in the community. So that's one example. The other more recent example that we just did a forum on, again, to try to assemble teams, is the issue of aging, is that our farmers are aging. And so there are, there are some specific needs, specific things that we need to have them think about so they don't get injured, or recognize the fact that they can't do the same things they did when they were, 20. And so how do we actually, engage a variety of folks? How do we assemble a team of folks that, can deal with, different exercises to keep us more agile, have a discussion about, resources for aging farmers, engaging kind of the local community as well as our healthcare providers in part of that process and education and outreach, developing material. So again, that is again an assembled team recognizing a particular challenge. So I think that's been a really hats off to the team that we've been able to approach, and it's actually broader than UMASH. It's much bigger with a number of folks throughout the region.
Thank you. And just to plug some resources that we do have on those two issues from UMASH, we recently hosted a community forum on aging on the farm, where we had a lot of great input and resources shared from partners across the upper Midwest, and that can be accessed on our website.